Hi, this is Dr. Brian Stanton. I want to discuss with you a tool that I utilize in my practice. This is a tool I've been using for the last 18 months. Now, I've been practicing applied clinical nutrition in my practice for roughly just over 10 years. But for the last 18 months, I've utilized a tool called an individually designed assessment. This individually designed assessment, or ID assessment, has over 7,500 independent third-party clinical studies that are part and ingrained of the software. Okay, that means these are studies that are out there done by thousands of researchers and thousands of doctors. Not my opinion, not the opinion of the nutritional supplement company that we're going to talk about later that offers this, not the opinion. These are third-party independent clinical studies, mean these are studies that are out there that they pull from. What these studies study is there's over 300 medical conditions and symptoms that study the interaction of nutrients, minerals, micronutrients, and vitamins, and how they help and support the body in relation to these conditions and symptoms. About 10% of them, or roughly just over 30 of these, you will not know you have unless you get the proper lab work done and the proper interpretation, which we discussed in a different video. Another thing that this assessment does that is very important is there's literally over 3,000 different medications, most of them prescription, some of them over the counter, that these studies have screened for. They study the interaction of nutrients, minerals, vitamins, and herbs, and how there may be a contradiction or a contraindication to taking these certain supplements with certain medications. So what it basically does is when it gives a recommendation of a supplement regimen you should be on, it's blocking what you cannot have, and giving you what you need. Because some of these medications that are out there on the market actually cause nutritional deficiencies. So the assessment actually will block what you cannot have based on contraindications, nutrient-drug, nutrient-herbal interactions, and give you what you need based on nutritional deficiencies or these medications depleting your body. Ever since I've been using this tool in my office, it's really helped streamline my practice and my nutritional side of things. Now, this is in my opinion, based on how I've been utilizing it in the last 18 months, this is the best foundational supplement regimen you can be on, okay? So if I need to add to it, I will, based on acute illness or inflammation or anything like that. But very useful tool in my office.